Hello, everybody. Now we are going to start our lesson 2, the role of nutrition in preventing and treating chronic diseases. So the learning objectives of this lesson are to understand the role of nutrition in preventing and treating chronic diseases such as cardiovascular disease, to describe different types of diets and their effect on health, to be able to describe the role of nutrition in preventing and treating and reversing diabetes, and to know how to prescribe nutrition for basic disease processes, including inflammation. What each of us does on a daily basis significantly impacts our health and our quality of life. Of all the lifestyle factors, nutrition and physical activity are the two that most impact our quality of life. And specifically, nutrition is really important to diminish the risk of chronic diseases, to have a healthy diet. So, in the World Health Organization fact sheet, it established that a healthy diet helps to protect against malnutrition in all its forms, as well as non-communicable or chronic diseases, including such as diabetes, heart disease, stroke, and cancer. An unhealthy diet and lack of physical activity are leading global risks to health. Healthy dietary practices start early in life. This is very important, that we start having these practices since the childhood. So it's easier, because changing habits when we are adults is much more complicated. And to be aware that our energy intake or calories should be in balance with our energy expenditure, so we don't lose or gain weight if these both are in balance. We have to limit the intake of free sugars to less than 10% of total energy intake, specifically from processed foods. A reduction to less than 5% of total energy intake is suggested for additional health benefits. Keeping salt intake to less than 5 grams per day, equivalent to sodium intake of less than 2 grams per day, helps to prevent hypertension and reduces the risk of heart disease and stroke in adult population. The WHO member states have agreed to reduce the global population's intake of salt by 30% to 2025. And they have also agreed to halt the rise in diabetes and obesity in adults and adolescents, as well as in childhood overweight, by 2025. We hope we can make it. So you have amazing articles during the course that you really should. I recommend you to read them. And specifically, for example, in this article where it shows the different kind of diets and the strength and level of evidence that are for each of them, you have to focus on the ones who have a strength of 1 and a level of evidence of 8 that are the best quality evidence. So for example, here it says that DASH diet is recommended to prevent hypertension and lower blood pressure. And the diet should be accompanied by lifestyle changes such as weight reduction in overweight people and increased physical activity, sodium restriction, and alcohol avoidance. This is the one that has more and better quality of evidence. Also, in the second level is the Mediterranean diet, that with restricted calories may present a healthy alternative to the typical Western diet, and it may improve quality and life expectancy in healthy people, as well as in patients with overweight, diabetes, and cardiovascular disease. And here in yellow, you can see that, for example, 1A evidence is that whole grains and dietary fiber are recommended to increase dietary fiber in order to reduce blood low density lipoproteins, cholesterol, and glucose. And also, we have 1A level of evidence that saying that low-fat milk and dairy products can lower blood pressure. Second grade of strength of evidence, we have that it's recommended to eat the whole food rather than fruit juice because of the fiber content, and it's recommended to use cooking techniques such as sautéing or simmering that preserve the micronutrients in the vegetables and fruits without additional calories. It's better to sautéing or simmering instead of frying, for example. And another second level evidence is that nuts and almonds are recommended to consume 20 to 30 grams per day unsalted, that is important, nuts and almond, or 150 grams per week as a substitute for other foods with equal caloric content to prevent weight gain in order to improve blood lipids. This is important to be aware that nuts and almonds, although they are very rich in nutrients and very healthy, they are high in calories and you have to be aware of your portions. There are other evidence too, but let's just say that the one strength evidence is that sodium is recommended to limit salt intake to 2.3 grams of sodium or 6 grams per day. And it is recommended to reduce as much as possible the use of industrial pre-prepared foods. All processed foods have added salts, as well as salted snacks and vegetables, and effort should be put into reducing sodium content in industrial foods through legislation. Policies has to be done to reduce salt. Now, for example, in Israel, we have these seals that indicate that some foods have added salts or added saturated fats, and this helps the public to really see what they are eating and to lower this kind of pre-prepared foods that has excess of salt added. And there are other things that is interesting here to see is that omega-3, for example, it's recommended to eat a variety of fish, preferably fat fish like salmon, at least twice a week. Each fish portion should be like 55 to 85 grams and should supply at least 500 to 1,000 milligrams of EPA plus DHA. So this is really important. EPA is eicosapentaenoic acid and docosahexaenoic acid that are very important essential fatty acids. To people that have proven cardiovascular disease, this is a second B strength of evidence, but with a very good quality of evidence. They said that individuals who do not regularly consume fish may consider ingesting omega-3 supplements. And this we already have mentioned it, so this is important in order to prevent cardiovascular disease. And there is evidence, good evidence, that plant phytosterols can be considered for the reduction of LDL cholesterol and in mildly hypercholesterolemic individuals. So this is interesting. Most of the cereals have phytosterols and they are enriched with this one, so it's important to have whole cereals. And here there are different kinds of diets. For example, Atkins diet, that is a very low carbohydrate diet that doesn't have any kind of caloric restriction, is unlimited in fat intake, and fruit and vegetables are severely limited. And this is not really something very recommended. But this diet has had very good effects on people for low in the short term to lose weight. It's a very, very low carbohydrate diet. There is another diet that is the low carbohydrate, low glycemic carbohydrates, like this the sandwich diet and the SONS diet, that again, no restriction, no caloric restriction. The fat intake is unlimited, but the fruit and vegetables, although are limited, you can eat them. What this diet, the Ornish diet, is a diet that has proven very good effects on people with cardiovascular disease. It's very low fat. It's mostly plant-based, vegetarian-based diet, and it doesn't have any kind of caloric restriction, but it has less than 10% of total calories are from fat. And for persons who have had that had coronary artery disease, coronary heart disease, this diet is the most recommended. Mediterranean diet doesn't have any kind of calorie restriction, no fat intake restriction, and unlimited vegetable and fruit intake. This is the diet that has the most evidence to be very important to diminish health risk. We are going to see it in the next slides. And the American Heart Association guidelines that has a caloric restriction, unlimited fat intake, and unlimited fruit and vegetable intake. But this restricts the calories. It's difficult for people to follow this kind of diets because they have to be counting calories. But again, this is the one that the American Heart Association is recommending. So with a very good quality of evidence, as we see, A is consistent, good quality, patient-oriented evidence. We can see that a very low-fat diet in combination with, no, I'm sorry, the Mediterranean diet confers morbidity and mortality benefits in patients with non-cardiovascular disease. So this is the best evidence that we have for preventing risk. Here, for example, the cardiovascular related outcomes of selected diets. We have here, it's very interesting, the effect of different diets on the lipid profile. For example, the very low carbohydrate diet doesn't change the low density lipoproteins, increase the good cholesterol, decrease the type triglycerides. But the best evidence, again, it has a C level of evidence. It's consensus, disease-oriented evidence, expert opinion, but the best quality, good consistent quality, is with Mediterranean diets that decrease or not change in low density lipoproteins, but increase the high density lipoproteins, that is the good cholesterol, decrease the level of triglycerides, and decrease the cardiovascular events. So again, this show has the best effects with the best consistent good quality patient-oriented evidence. So the conclusion of the diets and its effects on chronic diseases are that diets are rich in fruits, vegetables, and healthful fatty acids and limiting saturated fat intake seem to result in the best outcomes. The Mediterranean diet has extensive patient-oriented outcomes showing a significant risk reduction in mortality rates and in rates of fatal and non-fatal myocardial infarction. And the American Heart Association guidelines incorporates most of these recommendations without severe dietary restriction. It doesn't restrict fruits and vegetables, and it doesn't restrict fat intake. So there is a huge study, the Lionheart study, that demonstrated that the intake of the Mediterranean diet led to marked reduction in fatal and non-fatal myocardial infarction. And that combined outcome of those two, that unstable angina and stroke and pulmonary embolism. So this is the diet that has the best evidence, good evidence in diminishing risk for heart disease. This reduction in risk was almost by 2/3, and significantly beneficial effect of this diet was observed after 27 months of the diet and was maintained after 44 months of keeping this kind of dietary intake. Fish consumption has been shown to be inversely related to cardiovascular events, and it was demonstrated in the Nurses' Health study. And the highest threshold of fish eaters, that rate of cardiovascular events was 45% lower, largely due to the reduction in coronary heart disease rates and the incidence of non-fatal acute myocardial infarction. This was published in 2002. There is in this study, the Nurses' Health study, that is very famous, and you have the original article on the course. The intake of fish and omega-3 fatty acids leads to a reduction in thrombotic and thromboembolic stroke, also shown in the Nurses' Health study. So this is very interesting, how eating 2 or 3 times a week fish, we can diminish the coronary heart disease. Specifically, one of the seafood that we recommend is to eat wild catch salmon, also sardines, and Pacific mackerel. Diet and type 2 diabetes, effective lifestyle are the cornerstone in the prevention of type 2 diabetes. That's a fact. And there is a protective role of Mediterranean diet regarding the development and treatment of type 2 diabetes. Low-fat vegan diets are the ones that has better outcomes in people with diabetes. And research founded by Diabetes UK has discovered that type 2 diabetes can be reversed by extremely low-calorie diet alone. This is a very interesting article where the researchers prescribed a diet of I think 600 calories per day. So it was very few calories, but it has to be under medical supervision, and the type 2 diabetes was reversed. It was very interesting. You can read it in the course. So the DASH diet, that is the diet that is recommended for hypertension. Dietary interventions offer clinically significant net blood pressure reductions. Some dietary patterns may be more effective than others, and DASH diet intervention is the most appropriate initial recommendation when blood pressure control is a principal objective. Although weight loss and other factors, we always have to take them into account. The net effect for the DASH dietary intervention was similar to the effect of drug monotherapies for mild hypertension, so it's a very good effect. And here are 11 foods that are important that we take into account when we want to lower cholesterol. Oats, barley and other whole grains, beans and all legumes, eggplants and okra, nuts, any kind of nuts and seeds are very important. Vegetable oils, specifically the ones that come naturally, like olive oil, avocado oil, and those are the most important. Coconut oil and palm oil, although they are unsaturated, they are very good quality oils. Apples, grapes, strawberries, citrus fruits, foods fortified with sterols and stanols, as we said, and soy, edamame and tofu and all those products, and even soy milk are very good. Fatty fish, like we said, salmon, sardines, herring are excellent for this, and fiber supplements are important. When we're talking about diets and cancer, diet, physical activity, and body weight are major risk factors for developing certain types of cancers. Obesity and overweight are one of the highest risk factors for developing many types of cancer. So a balanced diet includes a variety of colorful vegetables and fruits, nuts, whole grains, and legumes, any kind, any color, and low in red, especially processed meats. Processed meats are the worst because they are full of preservatives, they are full of artificial flavors and salt added and sugar added and trans fats, so we have to avoid them. And if we lower the consumption of this, can help to fight cancer. Phytochemicals, or phyto comes from phyto, that means plant, can help to defend the body against cancer and other disease. The best way to provide the body with phytochemicals is to eat mostly foods of plant origins. Chronic inflammation can be caused by being overweight or obese. As I said, these are risk factors for developing cancers. And then we can see the AICR recommendation: be as lean as possible within the normal range of body weight. Maintain body weight range within the normal BMI range starting from age 21. Avoid weight gain and increases in waist circumference through adulthood, and avoid foods and drinks that promote weight gain. Energy-dense food sparingly, and sugar drinks and fast food. These are the worst things for cancer reduction. To avoid processed foods is the best. So for chronic inflammation, several human diseases are inflammatory in nature, as we know, including asthma. Most chronic diseases have inflammatory components, and the biochemical mechanisms are known, and the role of inflammation in disease pathogenesis is under investigation. But anyway, we should try to reduce inflammation through diet. Achieving or maintaining a healthy body weight is critical. Diets high in saturated fat and trans fat, the ones specifically from processed foods, are pro-inflammatory in nature. In this, it's important to have adherence to the Mediterranean style diet, but we're going to see what it means. But it's important to know that it may help reduce inflammation and reduce the risk of chronic diseases and of cancer. Low cholesterol diets may also reduce inflammation in the body, and hyperglycemia can cause inflammation, specifically refined sugar. So we have to limit the intake of sugars. So what is a Mediterranean diet? A Mediterranean diet is mostly plant-based, a lot of garlic and onion, avocado, asparagus, olive oil. Um, we are going to review it in the next slides, but in this diet, the Mediterranean diet also includes fish more than 2 times a week and includes whole grains, a lot of seeds and nuts, fruits in their whole form. So it's a very healthy diet and does not have to have any kind of calorie restriction. The important is the quality of the diet. There are certain biomarkers of inflammation, acute phase reactant proteins that we can find in the blood samples and in the white cell count, and cytokines like interleukins and tumor necrotic factor and other adhesion molecules as p-selectin, p-selectin and others. And these are important to know because in case that we're searching for this, to know if there is inflammation, chronic inflammation in the body, we can order this kind of laboratory tests. The oxidative and inflammatory stress is important to take into account. Macronutrient intake has dramatic acute effects inducing oxidative and inflammatory stress. So if we are overeating, we are causing our body to have inflammatory and oxidative stress, especially when diet is rich in saturated fat and refined carbohydrates. Postprandial inflammation following such meals is a potential mediator of atherogenesis, insulin and leptin resistance. And calorie restriction and weight loss, on the contrary, have equally impressive effects in reversing it. You have very interesting articles in the course talking about oxidative and inflammatory stress. I really recommend you to go through them, but this is like a summary of that. A meal rich in fiber and containing fruit does not induce either oxidative stress or inflammation. Most recent data show something interesting, that orange juice may actually neutralize inflammation induced by a high caloric, high fat meal. Red wine intake with a high fat, high caloric meal has also been shown to exert neutralization of its pro-inflammatory effects. And there are lots of foods and species too that can help with inflammation, that have anti-inflammatory effects, like tomatoes with the lycopene, fruits, specifically berries, blueberries, strawberries, oranges, and cherries, nuts, almonds, walnuts, and other nuts. All the nuts are very good. Olive oil and olives, leafy dark green vegetables like spinach and kale and collards, or the cruciferous. Fatty fish, as I said, salmons, mackerel, specific Pacific mackerel, tuna, and sardines. And to reduce all what causes inflammation, there are fried foods, fast food, of course, sodas, high sugar beverages, refined carbohydrates, margarine and all that, and specifically processed meats. So this is lesson 2, and we're going to follow to lesson 3.